Hello and welcome back to my channel. In this video, I'm going to explain what is a health psychology and how to become a practitioner health psychologist in the UK. So health psychology used to be known as a quite fairly new discipline, although it's been around for more than 40 years now. And I suppose from the NHS perspective, clinical psychologists who specialise in mental health have predominantly worked in the NHS and in both mental and physical health settings. But since health psychology has come about, there are far more health psychologists now working in private practice and in the NHS across several different physical health conditions, like myself in diabetes. There's health psychologists in chronic fatigue, in cancer, in heart disease, in weight management. So health psychology really is the discipline, the aim really is to look at the psychological processes underlying health, illness, and the healthcare system. Health psychologists work in not only the NHS, but they can work in public services, public health, within government to shape policies when it comes to healthcare. Some health psychologists work in training healthcare professionals, and others also work in private practice as well. So it's quite diverse when it comes to where health psychologists decide to work and where they can work. Now, to become a health psychologist or to call yourself a health psychologist in the UK requires a specific training path. The title health psychology is actually a protected title, and that's protected by the Healthcare Professionals Council and the British Psychological Society. So basically, you can't just call yourself a health psychologist if you have done the bachelor's in psychology and then gone on to do the master's in health psychology. And actually, it's illegal to call yourself a health psychologist if you have not done the accredited stage 2 training in health psychology. And I'll explain a bit more about what this training is. So now we have kind of explored where health psychologists work, what health psychology is. Put simply, that is understanding the psychology of health and really looking at how certain psychological issues like anxiety, depression, so the common mental health issues, may impact on somebody's health and well-being, but also it can impact on their health and well-being if, for example, let's say they're living with a chronic condition like diabetes. In order to become a practitioner health psychologist in the UK, there's several different pathways you need to kind of follow in order to be awarded this title. So first and foremost, you need to do the bachelor's, so the BSc in psychology through an accredited institution, and you spend about 3 years, maybe 4 if you do a placement like I did. You can take up to 4 years to do the bachelor's. After the bachelor's, you then have the opportunity to do a master's in health psychology, again through an accredited institution. There you spend 1 full-time year studying the Masters of Health Psychology, or you can do the Health Psychology Masters over the course of 2 years, perhaps, through a part-time route as well. After the master's training, you then go on to do what's called the accredited qualification in health psychology, also known as the stage 2 health psychology training, which is what I did. But I did this alongside doing a PhD as well. So in effect, you could call it 2 doctorates in one go. Now, you don't have to do it like this. This is actually called the independent route, which means that you are doing the stage 2 health psychology training independently, which means you're doing it at a university institution alongside doing the PhD, traditional PhD route as well. The other option is to do what they call a D-Psych, which is, a 3-year-long training program at, again, an established accredited university in the UK. And you have up to 3 years, maybe more, depending on how long you may need, the length of your research, for example, or sometimes even life events can take place, which means you might need longer to do your training. But there you're fulfilling all the competencies. So there's 5 different competencies when it comes to doing a qualification in health psychology. You've got the generic competency, which is things like communication and your organizing skills and, everything we need, in terms of workplace skills. Then you have research, and then you have the consultancy competency, your clinical competency, your teaching and training competency. So you can basically do this as a whole package as a D-Psych at accredited university. Then the third option is to just do the qualification independently, so without doing a PhD, without doing the D-Psych route, and you just fulfill those 5 competencies at an accredited institution over the course of a minimum of 2 years. It may take longer. It just depends on each individual and what their kind of requirements and their needs are as well. So now you have a little bit of an overview of what health psychology is, how to become a health psychologist. Please see the links below for more information at the Division of Health Psychology if you're interested in learning more about becoming a health psychologist and the training and the kind of education piece that comes with it. All the information is provided in that link below. So I hope that you have found this video useful and that you now have a little bit more understanding about what is health psychology and how to become a health psychologist. I'll be doing a more longer form video on this topic very shortly, so watch out. And please hit the subscribe button if you would like to learn more about health psychology.